Hello everybody, welcome to this webinar. My name is Nikki Roskowski and today we are going to do an HIV 101. We're going to be talking about the epidemiology, transmission and prevention. As I say, my name is Nikki and my pronouns are she, her, hers. What are we going to cover today? Well, we're going to explore what HIV is, talk about the difference between HIV and AIDS. We're going to look at how HIV is transmitted. We're going to talk through the health disparities that we have with this disease, how to prevent it, and I will take any questions at the end from anybody who has anything they want to submit. As this presentation goes on, you can certainly post questions in the chat box. That is a great way to post a question. There's also a Q&A tab as well, and you can post them in there and I will get to them at the end. So what do we know about HIV? Well, HIV is a virus and it stands for human immunodeficiency virus. And actually with HIV, the name tells us a lot about this disease. So human, it can only affect humans. There are very similar diseases in animals. For example, there is a version of this in cats, that is FIV, and this is a disease that originated in monkeys. So there is certainly a version called SIV that is in monkeys, chimpanzees, gorillas. But this one particularly is only going to affect humans, so you can't give it to animals or you're not going to get it. For example, if your cat has FIV, you're not going to get it from your cat. Immunodeficiency, that tells us what this virus does when it infects the body. It causes an immune deficiency. So HIV uses some cells called CD4 T cells to replicate. Now, CD4 T cells are white blood cells that we have in our body, that are obviously in our blood, that are an essential part of our immune system. And our immune system is essential to fight off diseases, infections. It's what keeps us from getting those things. And if we do get them, it then fights those off if it's possible. And we return to better health. That's what our immune system does. But HIV uses those essential CD4 T cells to make copies of itself. In the process of making copies of itself, using these CD4 T cells, it causes that cell to be destroyed. When somebody has HIV, and if they are not taking medication to treat their HIV, then this virus will gradually chip away at their immune system. What you likely already know about HIV is that it doesn't make somebody very sick immediately. It doesn't kill people immediately. It's a disease that takes some time. That time where there are no symptoms with HIV is not a time where this virus is dormant or it's not doing anything. It just hasn't caused enough damage yet that you would be aware of it. But all this time that somebody has HIV and maybe either isn't taking treatment or it doesn't know they have HIV, so isn't taking treatment, the virus is making copies of itself. So the amount of virus in the body is growing and the amount of these essential white blood cells is declining. So it causes an immune deficiency. And as we said, HIV is a virus. Viruses can be very tricky. There are other viruses that we don't have cures for either. So HIV is a disease that once you have it for life. Another example would be the herpes virus. That's also a virus, and it's also one that once you have it for life. There is no cure for it. Viruses are not fully independent living things. So they need to have access to cells to make copies of themselves. They don't do well outside of the body. HIV, particularly because it is using these CD4 T cells, it needs access to be able to get HIV. The HIV virus needs to get into the blood. And we'll talk a little bit more about that, but it replicates in the CD4 cells. So the virus needs to make its way into the blood to get access to these CD4 cells. And when we talk about transmission, we'll come back to that. The virus, this virus, the HIV virus, originated in monkeys, chimpanzees, gorillas. And it was in those animals for a very, very long time. Viruses and diseases can jump from one species to another. We know this has been the case with other diseases as well. One of the most likely ways that we ended up with COVID-19 is that it moved from one species to another. And this is how viruses survive. This is how they've evolved to survive. So the HIV virus started in chimpanzees, monkeys, well, actually started in monkeys, moved to chimpanzees and gorillas, and made its way into humans. There's a lot of different ideas that people have about where HIV came from, but there is very, very good evidence that this is how it happened. I know some people have some ideas that this was man-made, but all of the evidence tells us that that's not the case, and that it just jumped from one species to another. And it made its way into humans 100 or so years ago, likely. And then as these diseases do, as we've seen COVID, spread across the world. HIV it's a pretty new virus. It was only discovered in this country in the early 80s. So while we know it is likely that it moved to humans 100 or so years ago, it took some time to move worldwide and to reach the US. And it was first, as I say, discovered in the early 80s, but it certainly was in this country before that, because as we know, HIV goes some time without showing symptoms. And then to be able to establish this pattern that something new was out there took a little while too. And we talked about this various species of old world monkeys can be affected with SIV, and it's been present in those species for thousands of years. What's the difference between HIV and AIDS? Well, AIDS stands for Acquired Immunodeficiency Syndrome. And we classify somebody as having AIDS when their CD4 count drops below 200. So we talked about those CD4 cells, those white blood cells that are an essential part of our immune system that the HIV virus uses to make copies of itself. When that number that we have drops below 200, so when our CD4 count, or when somebody who is HIV positive has a CD4 count below 200, we classify them as having AIDS. Somebody who has HIV and is not taking treatment will eventually progress to AIDS. For some people, it goes very quickly. So some people not on treatment who have HIV might progress to AIDS within a year. Some people, it might take 10, even 15 years. For most people, it's somewhere in the middle there. But left untreated, HIV will absolutely still progress to AIDS. I have a short video for you just covering the basics here.
What's the difference between HIV and AIDS?
You have some questions? We know HIV. I'm a doctor. I'm trained for this.
We're gonna give you what you need. HIV is the human immunodeficiency virus that actually causes AIDS, which is the acquired immunodeficiency syndrome. AIDS is a clinical diagnosis and is associated with the development of symptoms and signs that suggest that people's immune system has been weakened so much by the HIV virus that now they're susceptible to other infections. So people who get infected with HIV don't always develop AIDS. And actually, nowadays, HIV infection can be treated in such a way that can actually prevent people from ever developing AIDS. What's the...
How is HIV transmitted? I would start by pointing out, for those of you who are joining us for this webinar, I do a lot, in normal circumstances, I do a lot of education out in the community, particularly with young people. And most people are not aware of this. They have some ideas, they know HIV usually can be transmitted by sex, but in many cases, that's the extent of it. This is great information to have, and this is, I think, great information to share as well when you're talking to teenagers about safe sex and STIs, so that they have a really good understanding of how this disease is transmitted. There are 4 body fluids that can contain HIV: breast milk, vaginal secretions or vaginal fluids, semen, and that includes pre-seminal fluid or pre-cum, and blood. Body fluids that do not contain HIV, tears, saliva, feces, and urine are just examples of some body fluids that do not contain HIV. But I've told you the ones that do. I give you that short list of ones that do not, because that's often where some of the misconceptions come along, is people's belief that they are, for example, that the HIV virus is in saliva. For somebody to become infected with HIV, the virus must reach the blood. There are other diseases, COVID being an example, that are transmitted differently, right? We're aware that COVID is, there are many ways that it can be transmitted, but often it enters through the respiratory tract, and that is how it makes its way into the body. HIV specifically has to reach the blood. And for it to do that, in most cases, it is going to enter through a mucous membrane. HIV cannot, for example, if there are no openings, the HIV virus cannot make its way through the skin. HIV needs to get inside of the body. And the reason that I say this is to point out that compared to some other diseases, HIV is actually a harder disease to get. You know, if I were to get someone's blood on my arm, I don't have any cuts or openings, it would be very, very unlikely that I would get the virus, because there's no way for it to get in. Of those 4 body fluids we talked about, one of those body fluids from somebody who is HIV positive and has a detectable viral load, so they have a virus in their body fluids, has to get inside of the person who is HIV negative to be able to cause infection. So that can be through mucous membranes, but it also can be through damaged tissues. And damaged tissues, sores, cuts, openings, can certainly happen around the genitals. And an example would be if somebody has an STI like syphilis or herpes, where they have sores or openings on or around their genitals, that provides an extra easy way for the virus to get in. It's one of the reasons that it's so important to get tested for STIs and get treatment if those come back positive, because not only do they have all the problems that come with having, for example, syphilis, but you also have an increased risk then of getting HIV. I'm going to talk a little bit more about viral load going forward, but when we have people in our clinic who are HIV positive, we have many patients who are HIV positive, there are especially 2 really important measures that they will want to know. One is their CD4 count. We talked about that. That gives us an indication of the health of their immune system. The other one is their viral load. Now, the viral load is effectively the amount of virus in the blood. And that can vary. It does vary wildly depending on whether they're taking medications or not. Somebody with a lot of virus in their blood and body fluids is much more likely to transmit the HIV virus, which makes sense, right? If there is more virus, for example, in semen, somebody with more virus in semen is more likely to transmit that to their partner than somebody who has very little or none. So the amount of virus, somebody's viral load is actually very, very important. And we know that when somebody has an undetectable viral load, so it's so low that we can barely pick it up, they actually, as long as they've had that for 6 months or more, they actually cannot transmit HIV through sex. And that is something that we refer to as undetectable equals untransmittable, or U equals U. So transmission through sex, well, there are typically 3 types of sex. There are certainly more things that people can do, but we're going with the kind of standard 3 different types of sex that somebody could be having. Anal sex is the highest risk of the 3, and it's especially high risk for the receptive partner, sometimes referred to as the bottom. But when we talk about the receptive partner, typically we mean the person who would be, if there was no barrier or condom used, would be the one receiving the body fluids. So anal sex is the highest risk type of sex, especially for the receptive partner. Mucous membranes in the rectum have a tendency to tear. These are even just micro tears during sex. It might not be something that somebody would notice, but these small micro tears just give the HIV virus a little easier route into the body. Then next to that, we have vaginal sex being the next highest risk type of sex, again, particularly for the receptive partner. So particularly for the person receiving body fluids. Oral sex being our lowest risk to potentially zero risk of HIV. Certainly the person who is giving the oral sex is very low risk, and the person receiving the person receiving the oral sex is no risk, because the only body fluid they are coming into contact with is saliva. So very, very unlikely to get it through oral sex. The reason I think it's important to understand the body fluids and how HIV works is that this is just 3 examples of the ways people have sex, but there is so much more beyond that that people might engage in. When somebody understands the ways that the body fluids that HIV is in and what it needs to do to get inside of the body to cause an infection, if you have that information, you can pretty easily work out whether something is risky for HIV. By understanding the body fluids, you can think about what it is that you're doing, what body fluids might be involved, and then assess the risk. Other things that can result in HIV infection: needle sharing. Needle sharing is very, very high risk, and I would place that above anal sex, because you're taking a needle that's been used by one person, so has had contact with somebody's blood, and then injecting that person's blood, although it isn't the purpose of what's happening. You're effectively taking one person's blood and infecting it and injecting it into another. Usually needle sharing, it can be for drug use. It can be potentially for maybe injecting hormones for people who do not have access to hormones and needles through a clinic. We have seen trans people who have not had access to that, so have been buying things online and have struggled to get the supplies they need, so they might have shared needles. But needle sharing is very high risk, because you're taking some blood from one person, even if you don't see it or don't realize it's there, and injecting that into the blood of another. So you're putting the HIV virus exactly where it needs to be. Mother to child transmission. So certainly many babies, certainly more so towards the beginning of the epidemic, were infected with HIV from their mother. Not always, but it certainly did happen. Today, in this state, it's very rare that that happens. I don't believe we've had a baby born HIV positive for about 3 years now, and before that there was only 1 or 2. So that's very rare now. And all we need is the mother to engage in treatment and to know, really for us to know ahead of time that the mother is HIV positive, and if she's undetectable, if she's taking meds, the baby is not going to get HIV. The only times really that still happens is maybe the mother doesn't know she's HIV positive and refuses testing, and there have to be several things go wrong for this to happen now. Needle stick injuries, so I mean, similar to needle sharing, and although different intentions, someone being stuck by a needle that's been used on somebody else, potentially there's again the movement of blood there. And tattoos, this is the one that is sometimes forgotten. And I'm not talking about tattoos done professionally. I'm talking about typically tattoos done unprofessionally, sometimes at parties, where they have a person doing tattoos, doing one after another, and maybe even if they are using new needles, sometimes the ink gets reused in these situations. And the risk for HIV it's low, but it's there. The risk for hepatitis C is a little bit greater, because hepatitis C lasts a little longer outside the body than HIV. But as we talked about before, viral load is important. Quick video for you to watch here.
The world is getting closer to achieving one of the most important public health goals of our time, eradicating HIV. And to do this, we won't even have to cure the disease. We simply have to stop HIV from being transmitted until eventually it fizzles out. Once, this goal would have seemed impossible. HIV has caused millions of deaths and is one of the most devastating diseases that humanity has ever known. But we're now at a point where new advances such as one pill, once a day medications are helping us tackle HIV in effective ways. HIV is a retrovirus, meaning it integrates copies of itself into an infected cell's DNA, allowing it to replicate and infect other cells. HIV has evolved numerous ways to evade the human immune system, which makes it difficult to cure. But by developing ways to block HIV replication, we can stop the spread of HIV itself. That's where antiretrovirals, aka ARVs, come in. ARVs are a group of drugs which work in different ways to combat HIV. Some block HIV's access into immune cells, and others work by stopping the virus itself from replicating. ARVs also work preventatively in people who don't have HIV. This type of approach is called pre-exposure prophylaxis, or PrEP. PrEP works by accumulating in a person's body and preventing HIV from establishing itself. That means an HIV-negative person who may be at risk of contracting the disease can take certain ARVs to protect themselves before they become exposed. Here's where it gets especially interesting. In people with HIV, ARVs can also dramatically reduce HIV transmission. This is called treatment as prevention. On a global scale, this has the potential to end the HIV epidemic. It's based on the idea that someone with HIV who takes ARVs can lower the virus level in their bodies until it becomes undetectable. That doesn't mean the virus is gone. It could still be lurking within cells, ready to reactivate if treatment stops. But so long as it's kept dormant with drugs, HIV remains undetectable. And when HIV is undetectable, it's untransmittable too. In theory, this means that by testing everyone who's at risk of HIV and treating those who test positive, we could stop transmission and eventually eradicate HIV. In the real world, however, things are more complex. Many at-risk HIV-negative people across the world do not have access to PrEP or ARVs, and those who are HIV positive may experience challenges to taking ARVs. These problems are often greatest in countries where the burden of HIV is highest. Getting these medications depends on access to a functioning healthcare system, and this isn't something everyone has. That's part of the reason why stopping the spread of HIV for good will require a significant investment of resources to improve those systems. One study carried out by UNAIDS estimated that between $20 to $30 billion per year would be needed to achieve a nearly 90% reduction in new HIV infections by 2030. This investment would ensure more people would get tested in the first place, and more would be able to access and maintain treatment. Achieving this goal and improving healthcare in general is in everyone's best interest, from individual people to society as a whole. We have roadmaps that could allow us to bring the HIV epidemic to an end in the near future, with the possibility of eradicating the disease altogether several generations in the future. In the period from 1996 to 2017, we almost halved the number of new HIV infections. And for the millions of people who still live with the virus, ARV treatments enable most to lead long and healthy lives. With continued and increased investments, we can get transmission rates low enough to end HIV once and for all. A world without HIV is no longer inconceivable. It's closer than ever. The progress we've made in treating and preventing HIV is incredible, but that doesn't mean we should stop searching for a cure. Learn more about the challenges of curing HIV in this lesson.
Hopefully that was a useful overview, maybe filled in some gaps that I had not covered. Let's just talk about health disparities and some data. approximately 1.1 million people in the US are HIV positive. We know that around 1 in 7, or we suspect that around 1 in 7 people, about 14% of those people living with HIV in the US don't know it. Because HIV, for in some cases years, people will have no symptoms. Not everyone gets tested for HIV, so some people have it and don't know they have it. Unfortunately, too many people, because they don't get tested routinely, only find out that they're HIV positive by the time that it has progressed to AIDS. So they start to get sick with other things, with opportunistic diseases that take advantage of their damaged immune system. And it's only then that they're diagnosed with HIV, which is a really important reason to get tested regularly, whether or not you see yourself to be at risk. It is important to note that HIV continues to have a disproportionate impact on certain populations, particularly racial and ethnic minorities, and we still see gay and bisexual men disproportionately affected. In 2018, 37,832 people were diagnosed with HIV in the US. Gay and bisexual men accounted for 69% of all HIV diagnoses in the US. So a really still disproportionate rate of gay and bisexual men. Important that as we educate around HIV, though, we make it clear that there are many people who are not gay and bisexual men who become HIV positive. One of the misconceptions out there is that this is just a disease that affects gay men. And that certainly is not the case, and it's a dangerous misconception. We also see that Black or African American gay and bisexual men account for the largest number of new HIV diagnoses, followed by Hispanic, Latinos, and then finally whites. So those racial disparities, we need to continue to work very, very hard to change that. And as I said, about 1 in 7 people in the US do not know that who are HIV positive do not know it. So how can we prevent HIV then? We can encourage people to use barrier methods, and by that we mean condoms and dental dams potentially. There are a variety of different barrier methods. The most common are the internal condom, which has been referred to in the past as a female condom, but being that it could be used for anal sex, it can be used for vaginal sex, and that kind of using it in that way actually relates in no way to gender, so calling it the female condom is not very accurate. So an internal condom, the external condom, which is the one you're likely to be most familiar with, sometimes referred to as the male condom, but again, because genitals and gender aren't necessarily, certainly aren't the same, that we can better call that the external condom. A dental dam, which is just a sheet of latex that can be used as a barrier for a range of things, but is typically thought of as something that somebody could use for oral sex as a barrier. We want to encourage regular testing. So we've talked about the problems with not getting tested and letting an HIV infection run for too long without treatment. Treatment is so effective at making sure that people living with HIV live long and healthy lives. So we must do everything we can to get anyone who's HIV positive onto treatment. U equals U refers to undetectable equals untransmittable, and we talked a little bit about that. So we want people who are HIV positive to have an undetectable viral load. PrEP is our daily medication that can be prescribed to somebody who does not have HIV, but is at risk for getting HIV. There's a strategy, a tool that we have had available since about 2014. And somebody who does not have HIV, but is worried that they could be at risk for HIV, can take one pill once a day. And while they're taking that medication, it's over 99% effective at preventing HIV. There is also PEP, which stands for post-exposure prophylaxis. And that's medication that can be taken after somebody may have been exposed to HIV to prevent infection. So, for example, something happens like somebody shares needles, or somebody has unprotected sex, or there's some kind of incident where somebody's worried they could have been exposed to HIV. A sexual assault would be another example, a needle stick injury. If they seek medical care within 3 days. 28 days worth of medication can be prescribed to prevent the HIV virus from taking hold. Now, that medication has to be taken within 3 days of this, whatever this incident was that that person was potentially exposed to HIV. But it's very important to note that the sooner you go, the more effective it is. And you would go to the emergency room for that. So if something happens, and we can prescribe this to children, if something happens where you think you could have been exposed to HIV, you go straight to the emergency room to get this medication. In some cases now, you can get it from pharmacies. Here in Syracuse, upstate university hospitals, outpatient pharmacy will dispense the first 7 days. They'll get you started the first 7 days without you needing to go to the emergency room. But in some cases, like a sexual assault, the emergency room is more appropriate. If you're getting tattoos, that you go to a safe licensed tattoo shops. Avoid needle sharing. We have wonderful syringe exchange programs available in Syracuse and across the state. So hopefully people have access to needles that are and do not need to share them with other people. Less sexual partners, I put possibly, because it's important to note that we could have one person who has one partner and they never use condoms, and they don't know the status, the HIV status of their partner, and they could have a partner who's with other people. And then we might have somebody else who has 6 partners. But every single time they use condoms and they're on PrEP, the person with more partners in that scenario is the lower risk. So we need to be open-minded and recognize that we can't there are different ways to make whatever kind of sex life you want to have, we can make it safe, or as safe as is possible. You know, there always is some risk with sex, as there is with crossing the road. You know, life has risks in it, but certainly if somebody engages in HIV prevention services, for the most part, they can have the sex life they want to have, but staying safe from HIV. And if there's anything else that you think I've missed, feel free to put it in the chat box. There are certainly other things that I haven't mentioned there. If you think there's anything important I've missed, pop it in the chat box. So I want to show you a video now on PrEP to give you a really good understanding of what PrEP is and how we can use it.
PrEP is pre-exposure prophylaxis.
What pre-exposure prophylaxis means is that you're trying to prevent HIV before an exposure has occurred. So that means that when somebody is taking PrEP, it means that they don't have HIV and they're trying to keep themselves from getting HIV by taking a medication to prevent it.
We try to promote the ease and availability of a once-a-day pill, but it's an actual program. It's a program where folks get an opportunity to meet with professionals, not only clinically, focus on, treatment with STDs, but also counseling, their sexual health counseling.
PrEP for me is communicating with my doctor about my risk factors, being honest and open with my doctor and truthful about my sexual history, current and past, on top of the medication as well. So that once-a-day daily pill, that's over 99% accurate in preventing you from acquiring the virus. All of that combined is what PrEP is to me. As a gay Black male, I have a 50% chance in my lifetime of acquiring HIV. PrEP isn't just for gay men, it's for any and everyone who's experiencing risk factors in their life.
Anyone who's having unprotected sex with partners who doesn't know their partner's HIV status really is a candidate for PrEP.
When I think about PrEP, it's about me taking inventory of where I am, being honest with myself, or as they say in the street, keep it real, to thyself be true. And if I sit back and do an inventory and know that, sometimes I can make some unhealthy and risky decisions, then this is possibly a medication that I need to consider taking. We talk about the younger population in terms of being at risk and the numbers being high, But what we don't talk about is the 50 plus being high. And so I'm 50 plus, right? And so this is very significant for me.
PrEP is a great option for college students. We often do a lot of mingling and meeting new people, so it offers protection and a sense of security.
It's appropriate for all demographics. And, you know, I want folks to have an open mind about who's appropriate for PrEP. And that even, you know, a low risk of HIV is too great of a risk.
We are lucky in New York State that our state benefits from a large needle exchange program, and through use of clean needles, people have really significantly reduced their risk of getting HIV through injection drug use. But that's still something that we need to really keep in mind, especially, unfortunately, as we're seeing more and more injection drug use. So it is a method of preventing HIV through injection drug use. And then also we know that sometimes when people are using, they may have higher risk associated with sex as well.
I experience a freedom being on PrEP, knowing that as long as I'm on my medication, I can be very intimate, right, with somebody, or I could possibly be in a relationship with somebody that's HIV positive and still have that companionship and that love and compassion that I would have in it with somebody who's not HIV positive.
It's actually giving, you know, my family and friends peace of mind as well. It's letting them know that, you know, granted I have other things to worry about, but as far as, you know, the big one, that I'm safe and I'm protected.
Others who are at risk for HIV, they have that panic inside of them all the time. It's affecting how they engage in relationships. It's affecting how they meet people. And that's really stressful. And PrEP adds the opportunity to take a step back and say, you know what, I can approach life in a different way and not panicking all the time about my HIV risk.
The PrEP pill contains two medications, emtricitabine and tenofovir. In the absence of PrEP, the HIV virus enters the body and attacks an important cell in our immune system, the CD4 T cell. The virus will fuse with the T cell and release its genetic material. It then copies or replicates this genetic material in order to assemble more versions of itself. Eventually, these viral copies will leave the T cell, spreading infection to other cells throughout the body. The medications within the PrEP pill block HIV's ability to copy itself, preventing the virus from spreading and setting up an infection within the body, keeping our T cells happy.
The pill only protects you against HIV, so you still have other things to worry about: syphilis, chlamydia, gonorrhea, trich, herpes, all of those other lovely things.
The people need to know that PrEP exists, because we still live in a community where people don't really know about PrEP, right? We live in a community also that has fear of acquiring medication, taking different medications because of some experiments that have been done in the African American community in particular, historically. So I think that people need to know about PrEP. They need to know that PrEP is safe.
Oftentimes when folks found out information, when they learned things, folks, because they knew better, began to do better. We should continue to increase our conversations about PrEP. We should continue to increase our understanding of how it can work, because we do know that in every situation, usually when you're talking about a relationship, eventually the condom must come off. So what other resources can we use? And I think continue conversations about PrEP, continue conversations about who PrEP is appropriate for is definitely something we need to do.
PrEP is an incredibly important medication. It is part of the three-pronged plan in New York State to end the HIV epidemic by 2020. And I am so incredibly happy to report that progress towards that goal is going in the right direction. So in New York State, including PrEP as one of our three major components in fighting HIV, we've for the first time, seen a significant drop in the new HIV diagnoses across the state since the beginning of HIV medications. Medications are used to treat HIV. So this is really big news. And I think it says to all of us in New York State and in public health that PrEP is a really important medication.
Hopefully that was helpful to be able to see how different people are using PrEP and how it can be beneficial to ending the epidemic in New York State. Does anybody have any questions or comments, anything that you would like to know? Put questions in the chat box. But here is my information as well. So as a reminder, I'm Nikki Roskowski, and I'm at SUNY Upstate. I'm an education specialist there in our PrEP program. My email address, jenning@upstate.edu. I just recently got married, so my email address is my maiden name. And then my cell number. If you or somebody you know or somebody you work with would like to start taking PrEP, then you can email me, or you can call or text me, but you can also give my number. That's my work cell number. You can give that to clients or patients to reach out to set up an appointment. We don't need a doctor's referral for PrEP. So if somebody wants to start PrEP, they can give me a call or send me a text, send me an email, and I will get them set up with an appointment. Thank you for joining this webinar. I hope it was useful to you.